everyone. Welcome back to English Boost Studio. I'm Emily.
And I'm Paul. We're so happy you're here with us today.
Paul, I have a question for you. Have you ever been really sick in another country?
Oh, have I? Let me tell you. Last summer, I was visiting my cousin in Italy. Amazing pizza, beautiful sights, and then bam, a terrible stomach ache. I was in my hotel room feeling awful, and I realized I need a doctor. But my Italian is just ciao and grazie.
Oh no, that's a scary feeling. What did you do?
Well, I was lucky. I found a clinic where the doctor spoke a little English, but it was so hard to explain exactly how I felt. I was just pointing to my stomach and saying, bad, very bad. Not very helpful for the doctor.
I can imagine. That's why today's lesson is so useful. We're going to learn how to talk to a doctor in English.
That's right. We'll learn simple words and phrases for when you don't feel well. Whether you're traveling, studying abroad, or just living in an English-speaking country, this will help you feel more confident.
And later, we'll do a fun role play. I'll be the patient, and Paul will be the doctor.
Don't worry, I'll be a nice doctor. Okay, let's start at the very beginning. How do you even get to see a doctor?
First, you usually need to make an appointment. You call the doctor's office or the medical clinic. A clinic is like a small health center. When you call, a receptionist will answer. That's the person who manages the appointments.
Right, the receptionist will ask you some questions. A very common one is, what's the reason for your visit? It's a polite way to ask, why do you want to see the doctor?
So you need to describe how you feel. You don't need complicated words. You can say something simple like, I don't feel well, or I think I have a cold, or my stomach hurts.
Perfect. They might also ask if you are a new patient or a returning patient. New patient means it's your first time at that clinic. Returning patient means you have been there before.
Once you have your appointment, you go to the clinic. When you arrive, you often have to fill out some forms. Forms are papers with questions. They will ask for your name, your birthday, your address, and maybe about your health history.
It can feel like a lot, but just take your time. It's okay. Then you wait in the waiting room. This is the room with chairs where everyone waits for their name to be called.
Finally, a nurse will call your name. A nurse is a medical professional who helps the doctor. The nurse might take you to an examination room. That's the small room where the doctor will see you. They might check some basic things first.
Yes, like your temperature. Do you have a fever? A fever is when your body is too hot because you are sick. They might check your blood pressure. That's the force of blood in your body. They use a cuff on your arm. It squeezes a little, but it doesn't hurt.
Then the nurse will say, the doctor will be in shortly. Shortly means soon. So you wait a little more, and then the doctor arrives.
This is the main part. The doctor will usually say hello and then ask, so, what seems to be the problem? Or how are you feeling today? This is your time to explain.
Let's learn some words to describe how we feel. These are called symptoms. A symptom is a sign that you are sick.
The most common word is hurt. My head hurts. My throat hurts. My stomach hurts. Very easy and clear.
For a headache, you can also say, I have a headache. For a stomach problem, I have a stomachache. Ache is another word for a pain that doesn't stop quickly.
Other useful words, sore. I have a sore throat. This means your throat hurts, especially when you swallow.
If you have a cold, you might be congested. This means your nose is blocked and it's hard to breathe.
Or you might have a runny nose. That means your nose is running. You need a tissue.
You might cough or sneeze or feel dizzy. Dizzy means you feel like the room is spinning. You might feel nauseous. That means you feel like you might vomit or throw up.
Good. Now the doctor will want details. They might ask, how long have you felt like this? So you say, for 2 days, or since yesterday morning.
They might ask, can you describe the pain? Is it a sharp pain or a dull ache? A sharp pain is strong and sudden. A dull ache is a constant, low pain.
They might ask, on a scale of 1 to 10, how bad is it?
1 is a little pain, 10 is the worst pain you can imagine. This helps them understand.
Then the doctor will probably examine you. They will look in your ears and throat. They might use a stethoscope to listen to your heart and lungs. They will say, "Take a deep breath." That means breathe in a lot of air.
After the examination, the doctor will give you a diagnosis. That is the name of your sickness. They might say, you have a sinus infection, or you have the flu, or it's just a common cold.
Then they will tell you what to do. They might say, "You need to get some rest and drink plenty of fluids." Fluids mean water, juice, and tea.
They might say you need medication. That is another word for medicine. Sometimes they will prescribe medication. This means they write a special paper called a prescription. You take this paper to a pharmacy to get the medicine.
Some medicine is over the counter. That means you can buy it at the pharmacy without a prescription, like pain relievers for a headache.
So let's review some key sentences you can use. Repeat after us if you want to practice.
To describe how you feel, I have a headache. I have a sore throat. I have a fever.
To answer the doctor's questions, I've felt like this for 2 days. On a scale of 1 to 10, my pain is a 6.
To ask the doctor, what should I do? Do I need medication? Should I come back?
Perfect. Now we have a challenge for you. We want you to practice. In the comments below, write a sentence. You can write, if I am sick, I would tell the doctor my head hurts, or the last time I was sick, I had a sore throat.
Just try to use one of the words from today. We read all your comments, and we love to hear from you. It's great practice.
Before we finish, if you enjoyed this lesson and you want to learn more practical English,
Please hit the like button and subscribe to English Boost Studio. It helps us so much. Click that bell icon too so you never miss a new lesson.
learning how to talk about health is so important. We hope this makes you feel more prepared and less nervous.
Remember, it's okay to speak simply. The doctor just wants to understand you so they can help you feel better.
Thank you so much for watching and learning with us today.
Keep practicing, and we'll see you in the next video. Bye for now.
Goodbye. Take care.